Hi, this is Dr. Corey Maas on Looking Your Best, and I'm very fortunate and I'm blessed to have a patient who's willing to share her actual experience or journey, as I'd call it, because I really do think it's a journey when you go into facial plastic surgery, and specifically a facelift and a few other minor things for a patient who is, and I'll let her describe it. And her name is Lisa, so you can see her image here to my left, and but more importantly, you're going to see her and have her talk about her experience and the journey that she had for facial plastic surgery and how she feels about it, and the facelift journey is pretty common and one that lots of people experience, but best told. I think really the best stories are coming from patients, not from doctors. So I'll start by saying that and introducing Lisa. And so tell me a little bit about what made you decide to have a facelift or plastic surgery?
Well, I think that's an excellent question. Probably the most important question that someone needs to ask themselves. And in my case, I labored over it for a while. Probably because I was going through a lot of transitions in my life. New start, actually never felt better physically, but I still had voices in my head from Mom, who recently passed away, and Grandmom, who was beautiful in her 90s, and my alive father, who's 96. And the general consensus was, we don't mess around with our face, just age naturally and everything's great. Take care of yourself. But I had an association with plastic surgery being kind of, for shallowness. Mm-hmm. And of course, I've recently been totally turned around by that attitude. Mm-hmm. I think it goes a lot. I think plastic surgery goes deep. But the question as to why, I had certain physical things that didn't match the way I felt. And certain clothes I didn't want to wear because of my neck. I wouldn't be wearing this choker because I felt it accentuated my neck. Certain things that just bugged me. And it's a luxury to have the ability to do something about these things. I had so many fears just based on the fact I've never had any surgery before. So the idea of being put under was scary. Mm-hmm. Cut open was scary. And so I had to make a decision based on the fact that my life seems to be passing quickly, and I'm 65 years old. And
well, you don't look like you're 65.
Thank you. I'm having a lot of fun with, quote, not looking like but this is what 65 can look like. That's the deal. I mean, women and men are maintaining their health longer. And as I previously said, I was at a stage in my life, so many transitions, new start, fresh start, kids grown, happy, thankfully. I had some kind of means that I could have the luxury of doing this. And I didn't want to be governed by fear and voices in my head and judgments. Mm-hmm. And so it's something that I wanted to do for me. I'm at a stage in my life where I've decided the next few years I want to spoil myself and kind of, do what I want without hurting anyone, but basically do what makes me joyous and live each moment to the fullest. Because I am 65, and chances are I'm not going to live till 120. Although if I do, I'll be getting plastic surgery probably. But at any rate, yeah. So I decided to go for it, and did.
Well, you got the longevity genes for sure. So with your dad being at home at 96. So, and then you have, I'll say, family experience with plastic surgery in the past with plastic surgeons in your family. But yes. And you can include what you might have learned in that. But how did you choose the Maas Clinic and me as a surgeon to come to?
I had a very good friend, and she extolled your virtues with fillers. Mm-hmm. I love fillers. I've been using fillers. I started with Botox at 50, and I was really scared about that. I was just the last person in line, and I was very scared. And then I just thought, well, that's pretty amazing. So I stuck with fillers. But when my friend recommended you, as you may remember, a few years ago, I was like, do not make me look weird. I do not want to look like I've had fillers. So in a sense, plastic surgeons have a weird career because we all want to go to you, but we don't want anyone to know that we went.
Right.
Right?
Yeah.
So I was very, very frightened.
You don't want to look like you've had things done.
We don't want to look like we have had plastic surgery. Just want to look better. So I made it very clear to Dr. Maas, do not make me look weird. Please. Otherwise I'm not coming back. So he did a great job, and no one thought I looked weird, and I was super happy. So I think our communication over those couple of years was also very good. Very happy my friend recommended you. She was correct. She's good at research. I am not. So I have friends do the research for me. She did the research, and that's how I got here. Yeah.
So how... and I think you're sharing what a lot of people, your expectations when you come into, I mean, we obviously go over things and talk about, what to expect and what you should normally have, but you probably come in with some of your own, concerns and, I mean, I don't know, fears or excitement or whatever it is. Can you tell me what your expectations were, and then were they met or not met, or did you realize those expectations? Were some of them off base? Or
well, yes, I can tell you very, very well that I had expectations. Number one, I wanted to stay alive. That was good.
That's a good one, yeah.
Being put under and all.
Yeah.
That worked out well. And, I think my main concern was the neck, and I couldn't wear certain shirts because it would kind of like wrinkle up my neck even more. Now I can wear anything I want, and I just love it. But my main concern is...
Put that side view picture of you, the profile view up, then you can...
My main concern was, again, not to look strange. So I wanted to look fresher. I really didn't want anyone to know that something had exactly been done to my face, and I had just the result I wanted. Even a week after, I went to pick up some dry cleaning, and the guy looks at me and he goes, "Wow, did you get a new boyfriend or something?" And if people would make these comments. I dance, and during COVID, we couldn't dance anymore. So we, after like a couple of years, we finally get together with these people, and people are aging, and people would dance with me and go like, they'd have a funny look on their face, just like, or they'd mouth something like, "Look, really, you look good." Mm-hmm. So people noticed, absolutely, and I got a lot of support in that I looked great. Like, what's going on in your life? You look different and great somehow, but they couldn't peg it. Obviously my friends knew, and obviously I'm open about talking about it, but it was really fun. It's still fun, actually. I'm still having a lot of fun. So I'd say my expectations were exceeded, because actually I expected to have scars. Now, everybody is different, but I thought I would have, scars, and I literally... That
are noticeable, yeah.
Well, no one can even, like my hairdresser or whatever, we can't find them.
That's good. That's what we're going for.
Yeah. So I'd say exceeded my expectations, yes.
So that's great, and that's always good. So if you come in with, I think reasonable expectations is what most of us, sort of assess patients for, and you obviously came in with very reasonable expectations, and if we can exceed them, that's great. Were there any things that stood out to you during the journey between, starting, the whole thing, the consult, and then we do a little pre-op, and then, you come in for surgery, and then you have the surgery, and you obviously don't remember any of that, but afterward, was there anything that stood out to you as as a moments that were sort of sentinel moments during the procedure, after, before?
I think so. I mean, I spent the night in the recovery room.
Mm-hmm.
I was glad that I did spend that night. It takes any kind of stress off. I felt super safe. As you remember, I'm very sensitive to, and I just had a feeling to whatever, anesthetic, whatever.
Mm-hmm.
There's certain things I can't take, whatever. And we went through all that, but sometimes you still get sick. So I was one of those people, I woke up and I was throwing up. I was sick. And I was so impressed with the fact that I barely knew where I was. I woke up, I knew I was in the recovery room and I was just ill. And you were there and like, shot through the door, like, oh, and gave me a shot, and I mean, I think that's really, I didn't know that I even knew what time of day it was, I just knew I was really, they gave me a tube, it was beautiful, everyone was just on it, the anesthesiologist called me the night before, which I thought was a nice, kind of go over things, even though everything's written down and you can read it like 500 times a day if you want. So I love that. And the moment that really stands out is the day after. It was a long night, but I just felt very safe, very cared for all night. And the next day is when you came and you get, because your head is wrapped.
Dressing, yeah.
And I've been online, which you shouldn't do this. Everybody says you shouldn't do this, but of course, for months before, I'd looked up every complication I could online, and I was researching, and so I expected, and I didn't want to look at myself all night. I was just like scared of what I would look like. I was literally petrified that I would look like a purple pumpkin. Mm-hmm. And so you took me in to here in the office, and I was all wrapped up, and then you took them off, right?
Yeah. And
then the staff, I think there was some staff members there as well, and we took off. You made me look in the mirror. Mm-hmm. And I will never forget. It was like I'd had a drink from the fountain, in a movie, and you drink and it's like the years fall off your face, And I looked in the mirror, and honestly, I can't expect everyone will be as lucky as I am in terms of bruising and certain things that we can't determine. I was careful, but I looked great, in my opinion. Mm-hmm. So that was really fun. That was a moment, and where everyone was so happy for me, and like, oh my goodness, it was like a big party. Yeah. Obviously, I think I had a little bruise on my neck or something, and that was, and I was careful after. But it was, that was the fact that you were there when I needed you instantly was great, and I felt that this office is always responsive. If you have a question or you have a concern, it's dealt with immediately. And the glory of the unveiling was very poignant.
Yeah. So the reveal, that's fun. That's a fun moment for us too.
It was really fun, yeah.
So, and I made some notes because the opportunity, again, Lisa, I really appreciate your taking the time to do this with us. Did anything, well, let me ask you this. Do you think this has had any impact on your confidence or self-image or any of those things that are not often talked about, but really, yes, I think are very, very big, yes, parts of this? It's not just how you look, but how you feel.
It's how you feel, and it really does all come from the inside. Mm-hmm. You can do anything to yourself, and if you're not okay inside, it's not going to matter. But in my case, it was transformational, and my boyfriend, who was with me all night, actually took a video of me wrapped up, and I was like the Buddha, and I had all this stuff to say, like, oh, they think plastic surgery is a shallow, vain experience, but really it's very deep, and I understand, like recovery and this and that, and old people, and I just really had a lot of insights. But I'm saying that afterwards, I think the biggest thing was that I did what I wanted to do for me. Mm-hmm. I didn't do it for anybody else. I didn't follow the, doctrine of my family or anything. I was fortunate, everything turned out well, but it actually gave me I feel empowered by the experience. That I can take charge of my own life, and I can do stuff that I determine I want for my needs. And, based on my own personality type, that was a transformation for me. And I feel constantly empowered by it. Like, yeah, it's time for me to take charge and really do what I feel is best for me.
Yeah,
not wanting to hurt anybody else or anything, but just, live my life to the fullest.
Yeah, so you're
I feel strong like bull.
There you go.
It made me feel great inside as well. Yeah.
Yeah, and so you're assertive and obviously very, very smart lady, very pretty also, and have a lot of, if history is any, and your family history in particular is any predicator, you've got another 30 to 40 years left. So
we never know. That's why it's important
That's
to
true.
really, if you have the opportunity to be happy and add joy in your life, go for it.
Yeah.
I think that's pretty much.
So good. So it got your. It sounds like you got to a good place for you.
Yeah, it was
basically.
just a great decision that I personally made, and I was so worried, and it said it wasn't an easy decision, but I'm very grateful. I'm grateful for the work that you did. I'm grateful I made a decision. I just keep coming back here.
Yeah, and we love having you. So, and then is there, this is a good question, I think, and it came actually from our staff to ask, is that, well, one of them was they wanted to get feedback on how did you feel that you were treated by the staff, because I obviously can't do everything, but was your...
I love the staff. They're so sweet. Sometimes I even bring my toy poodle here, and they're really good about that, and they fuss over. I feel always like VIP,
Good.
Everyone, all patients should feel like VIPs, but staff is warm, competent. What more can you ask for?
That's right. I agree.
Never had a bad experience.
And then probably one of the more important questions is if you were going to give someone advice that was considering doing a facelift or whatever, facial plastic surgery thing, plastic surgery in general, what advice would you give them some of this you can bring in from your prior family experience with working, with plastic surgeons and things.
I think the first is qualifications, which you can easily look up, board certifications. I would prefer to go to something like, I knew that pretty much that's all you did. Mm-hmm. And I also got the feeling that you really enjoy it,
Mm-hmm.
You want to go to somebody who loves what they do.
Yes.
And Dr. Maas just loves doing this section.
That's the section.
Of your body. And it just gets a thrill out of it, and I like that. So I'd say qualified, absolutely, check the credentials. Number 2, make sure you can communicate well with your surgeon. You've got to be on the same page, and you should feel comfortable. You shouldn't feel awkward about talking or asking questions or communicating it at all. And make sure it seems like your surgeon loves their work. That's important, and they'll probably do a good job.
Yeah.
Yeah.
Well, those are all great things.
Word of mouth is good.
Were there? Yeah, I think word of mouth is
probably the best way to find out about somebody.
Yeah, for
Stay
sure.
away from Yelp. Don't go there.
That's a pay-to-play thing, so that's that's always been a nemesis for all of us, I think.
All businesses.
Yeah, really, all businesses, true. Was there anything I didn't ask about that you would say would be something you wanted to communicate about your journey?
No, really, I'd like to talk. As we all know, I'd like to talk about my experience for just all day long, and we just have to condense it because it was that good.
Yeah.
So
you had a little nausea afterward.
I did, yeah. As far as some complications, I was a little sick after, but that went away. Dr. Maas said, eat, which is hard when you're feeling nauseated, but it worked really well. And that's another thing. There was always snacks and little, apple juices and stuff like that. So I was eating little bits all night. Mm-hmm. I highly recommend staying the night. I wouldn't have wanted to go home.
Yeah, we have a little studio apartment.
I don't recall. I'll tell you one thing. People might be curious, like, does it hurt? Things like that. And I don't really. It's a weird feeling for me, and maybe everybody's different. For me, I was very numb. Mm-hmm. So you just, so your face feels weird.
Yeah.
It's not painful.
Mm-hmm.
I don't recall having any pain at all during the operation. It's just irritating. You know, you lie down and it's like, it's like there's felt like my ears were poking into my head.
Yeah, your ears are numb.
Your ears are numb. So other than that, yeah, I think
and that's temporary.
I had a little bit of nerve issues.
Oh yeah, yeah.
And Dr. Maas said they would be resolved, and they were. And so I just, in my case, very little bruising, and no scars that I can identify. So you say there's some scars there, but since I can't see them, I'm just gonna.
Well, they're all well hidden, so that's the main thing.
They are hidden, yeah.
Well, look, I can't tell you how much I appreciate your taking the time, you know.
Oh, I'm glad to
share.
To be here, because I would have actually loved to talk to somebody who had done this, and I didn't get to. So hopefully this is helpful for people who are just curious.
Yeah. Yeah, for sure. That's an important thing, in having a list of patients that we do have. But you know, I think people talking about their experience, and it obviously varies, you know, person to person.
It does. So maybe that's why it's difficult.
But most people don't, like, just like you, they don't have. We give everybody pain medicine. Rarely do people take it. If they do, I always caution them, because that's really what makes them nauseous.
Yeah, I didn't.
That's what makes people nauseous usually. And then if they don't eat before taking it, especially, it's a problem. So it's better to try to do. And I did this I had spine surgery. I didn't take any narcotics afterwards, just Tylenol, and I feel like I did a lot better because of it. Well, thank you for sharing your journey with us, Lisa.
Thank you for having me.
It's a pleasure to have you always.
I'll be back.
Well, we'll be looking forward to seeing you.
Thanks a lot.
Okay, thanks.